Okay, so recording's underway. Dee-Anne, I'll turn it over to you.
Great. So as we know, the provincial government is slowly beginning to reopen the doors to our provincial economy. Even in these early stages, many employers are starting to make plans for reopening their own doors and considering how to do this in a safe manner. But remember that regardless of government announcements, employers will need to make their own determination as to whether or not they will open their physical workplaces. Keeping in mind when they're determining this that they have the duty to protect their employees as well as stakeholders as well. Having a rational and a documented plan in place for reopening is necessary to ensure that smooth transition back to the physical workplace. This presentation, it is general in nature, and I encourage you to go to the govnl.ca/COVID-19 website for the most up-to-date information on what the public health orders are and guidelines specific to your industries, as well as any new recommendations that the government is putting out sometimes on a daily basis. It's also important to note as well that this webinar and the information within it, it's not applicable to workplaces where healthcare is being provided to COVID-19 infected individuals. Employers of healthcare workers, first responders, it's their responsibility to ensure the occupational health and safety and infection prevention and control practices within their workplace and their context of work aligns with the local public health association recommendations for the healthcare sector. And all of this information today is current as of June 18. I did go into the website this morning and there's nothing new there as of yet today. Workplace NL, we are the Workers' Compensation Board in the province. We have about 13,000 injured workers, and we provide services to approximately 19,000 employers. We are an employer-funded, no-fault insurance system that promotes safe and healthy workplaces. We provide return-to-work programs and fair compensation to injured workers as well as their dependents. I work in prevention services, myself and Sheri. We are a staff of about 30 to 35 staff, and our main focus is to promote occupational health and safety, or OSH, as we have shortened it, education awareness with employers and employees throughout all workplaces in the province. So today we are going to actually incorporate micro breaks every 30 minutes. And it's something that we encourage at Workplace NL, just because, well, not just because it is, it's very important that if you're in a prolonged posture, such as sitting, where I am right now, that we get up and we move our body and we do some light stretches to get the blood flowing. Micro breaks have been shown to reduce pain, discomfort, as well as reduce the incidence of musculoskeletal injuries, or MSIs themselves. So they're only meant to be very, very quick, just to get you up and to get you moving around. And if you're not able to get up, they're just meant to sort of, just to get a little bit of movement in your body by perhaps stretching your arms over your head and stretching out your neck and things like that. So I will bring you through a very short micro break. So today we're going to talk about the risk assessment for COVID-19 that workplaces are required to do in the province. We're also going to touch on some public health measures that have been recommended by the Chief Medical Officer of Health, and we're also going to have a Q&A as well. Just a quick note on the Q&A. Sheri and I, we work at Workplace NL. We are, as I was saying, the education and the awareness side. We are not enforcement of occupational health and safety, so we can't answer any questions regarding legislation. Included in that, we're not public health officers or officials either. So any questions that you have regarding specific public health measures that you may need to have for your particular work situation, we would certainly direct you to the Chief Medical Office in Public Health for their guidance for sure. So employers have the duty under the OH&S legislation to protect the health and safety of workers and provide a healthy and safe workplace. Employers are required to implement preventative measures to ensure that the workers aren't exposed to conditions which could be harmful to their health and safety while they're working. To meet the obligation to provide this safe working environment, it's imperative that employers conduct their risk assessment. From this risk assessment, update and implement, and in some cases, they have to post new health and safety policies, procedures, and practices in the workplace to address the risks that are associated with the COVID-19 pandemic. And of course, these are going to vary from workplace to workplace because we're all different and based on the specific needs of the individual workplace. Legislation gives us responsibilities. It also gives us, as workers, 3 basic rights. The right to know. We have the right to know about all of the hazards that we face when we're in the workplace with regards to COVID-19. Workers have the right to be made aware of all the hazards that they may face when they're returning back to that physical workplace or when they're in the physical workplace. We also have the right to participate in any decision that is being made to help protect our health and safety. So what this essentially means is that employers communicate and consult with workers in the things, the measures that they can take to keep themselves and others safe. So we're preparing to open up the economy. We're preparing to move back to the physical workplaces and a new way of working. Thus, it's important that employers communicate and consult with the workers to find out ways to make this transition and this situation safer for everyone. And of course, as a worker in the province, we have the right to refuse work under reasonable grounds that we feel is dangerous and unsafe for our health and safety and the health and safety of others. The COVID-19 alert level system, as we know, was put in place back, I guess, in the middle of April. And it provides Newfoundlanders and Labradorians with an overview of the 5 steps that the province is going to take as we relax public health measures and as we continue to live with COVID-19. Public health measures, as we know, are being reduced in a gradual step-by-step basis. The province is moving through the alert levels gradually while continuously monitoring COVID-19 in our communities, and we may move up or down the alert levels as needed. Businesses are expected to follow guidelines and to develop plans in order to continue operations throughout the COVID-19 alert level system as we continue to work and live through those levels. Guidance documents are available on the gov.nl COVID-19 website, and there are information sheets there as well for individuals and businesses operating at each alert level. So I certainly encourage you to go there and to have a look at those information sheets. They have a number of different industries that are there that you can certainly find some really good up-to-date information. So the government, in consultation with the chief medical officer, they're monitoring the following factors in order to make the decisions when moving to lower levels. They look at the spread of COVID-19 is actually controlled, and the public health measures that we are currently taking are working, and it's controlling the spread. They also look at their ability to test, trace, as well as isolate all cases and any cases which, of course, have tested positive. They're also looking at the health system and the ability of the health system to be ready to handle any surge in cases that we might have. They're also looking at the risk of outbreaks, and if they feel that there's a high risk of an outbreak, they may decide to move us back. They're also looking at workplaces and how prepared workplaces are to protect the health and safety of the workers as well as the public. And of course, we do know that there are some travel that's going on, essential travel, of course, and anytime that they identify any travel-related cases. And then, of course, one of the public health orders is the 14-day self-isolation. They certainly look at that factor as well. And just the overall community's readiness to live with COVID-19. How are every community in the province ready to live with COVID-19? So those are all the factors that they consider when moving down levels, but of course that also helps them to move up levels when we are at a low risk of infection. So some guidance for all alert levels. Stay at home, of course, when you're sick, unless you have to get medical attention. Stay informed and follow public health advice. Practice good hygiene, so our hand washing, avoid touching our face, coughing and sneezing into our shirt sleeve or into a tissue, maintaining our physical distance of at least 2 meters or to 2 arms length. And if we can't do that, excuse me, using a non-medical or a cloth mask when physical distancing cannot be maintained. Cleaning and disinfecting high-touch surfaces frequently. So things that surfaces and objects that people are touching frequently, they have to be cleaned and disinfected much more frequently. Working from home where possible, that's always going to be a guidance for all of the alert levels for sure. But as we know, some of us are getting ready to move back into the workplace. Continuing to shop online and use curbside pickup where possible. Limiting our non-essential travel in and outside of the province. And as we know, on July the 6th, the government will be making a determination about the Atlantic bubble. So we'll have to stay tuned for some more information on that. And it's also good as well to keep a log of when you go out in public, where you are, any interactions that you've had, and the people that you have spoke to as well. So as I discussed on that previous slide, wearing a cloth mask is an additional measure that you can take to protect others around you when it is more difficult to keep that 2 arms length away. So how do the cloth masks themselves actually help prevent the spread of COVID-19? It's wearing a homemade cloth mask or the non-medical mask has not been proven to protect you, the person who's wearing it. Therefore, it's not a type PPE. These masks are not able to filter out many of the droplets that are produced by somebody who coughs or sneezes. Medical grade masks are the only ones that are certified to prevent the spread of viruses and actually protect the wearer from the droplets of other. However, it's wearing a cloth mask is an additional measure that we know that we can take to protect others around us. It protects others by trapping the droplets from you so they don't land on other people or surfaces. And of course, this reduces the chance that others are coming into contact with your respiratory droplets in the same way that covering your cough with tissues or coughing or sneezing into your sleeve can reduce that chance as well. And if you go to the government website, there is a guidance document there on cloth mask and non-medical face mask. And it's a very detailed document, so I certainly encourage you to go there as well. COVID-19 spreads by breathing in respiratory droplets of people that are infected, having that close personal or physical contact with people, such as handshakes, giving hugs, as well as touching something that somebody who has been infected has touched. Surface contact is important to consider because COVID-19 can persist for several days on certain types of surfaces. So for alert level 2 that we're moving into, we'll be having a determination on that, I guess, on Wednesday. Mostly, small gatherings are permitted, but they haven't come out with the actual numbers yet. Higher risk businesses can open, and of course, they're subject to conditions, and all of those conditions are listed. Well, not all of them, but on the Government of NL website, there is a guidance document there for alert level 2, which kind of gives the overall view of what is going to be allowed to happen, but the details of what's to come aren't there quite yet. Medium risk recreational facilities can open as well. Some indoor facilities, such as pools, playground equipments can be used starting in level 2. Bars and lounges, indoor entertainment, arena, those types of things are going to be permitted to reopen or to continue based on, of course, public health restrictions and guidelines. And all of this is subject to change based on available information, as well as any public health directives that are coming out. So that's why it's important that the public that they consult with the Government of Newfoundland website on a daily basis, just to make sure that nothing has changed. If you're feeling any type of symptoms of COVID-19, which is the fever, the cough, the sneezing, red spots on your hands, or anything like that, and you can get a whole list of symptoms, of course, on the website, it's recommended that you do the self-assessment tool. That helps you determine whether or not you should be tested for COVID-19. You can get this tool on the 811 Helpline website. If you're not able to complete that tool by yourself, or for whatever reason, you can certainly have somebody do it for you, or you can call 811 and they'll take you through the assessment itself. It's recommended that you not visit your doctor's office unless, of course, it's a medical emergency, and that you not visit the emergency room. Call 811 and they will give you that guidance. So one of the things that the OSH division is going to be looking for is the risk assessment for COVID-19, and Sheri is going to take us through the majority of that. The risk assessment allows us to identify what our particular hazards are with relation to COVID-19, allows us to evaluate that risk, as well as to put some controls in place that are specific to our workplace. And when you're doing a risk assessment, it's also important to remember that some employees may be at a higher risk for serious illness, such as COVID-19, including older adults that are over 65, those who are immunosuppressed, and those who have chronic medical conditions, such as diabetes and high blood pressure. So those individuals you would certainly have to consider. So what's everyone's role in the risk assessment? Well, as the employer, it's the employer's role to do the risk assessment, to develop the plan, to put controls and measures in place following the public health guidelines, the physical distancing, the cleaning and sanitization, hand washing, those types of things, to do training with supervisors and workers, and as well to make sure that you're documenting everything that you're doing with your workers. As a supervisor, the supervisor is to ensure that workers are knowledgeable of the hazards of COVID-19, that they understand the public health measures and the control measures that they have to follow, the importance of them. And of course, they're also involved in the training and the education of the workers as well. As a worker, we have the responsibility to know our workplace hazards. We have the responsibility to participate in any training and education that our employer provides to us in decreasing our risk of contracting COVID-19. And we have that responsibility as well of following any of the public health measures, procedures that our employer has put in place for us. So we're going to have a very short micro break now. So whatever position that you're in, if you're sitting, you can certainly stand up. If you're, and that's if you're able to. If you're not able to, what I'm going to do is, and you can certainly do this sitting, I'm going to put my arms over my head. I'm going to clasp my fingers together, turn my palms over, face the ceiling, and I'm going to have a nice little side bend. Now make sure that your knees, if you're standing, your knees are bent. Just have a nice little stretch. So this is something that we encourage everybody to do, is to incorporate movement into your workday, and not to be taking these prolonged postures, whether that's sitting or standing for very long. You need to get up and you need to move your body. So when you come up to the side, then you can give yourself a nice big hug by putting your hands behind your shoulders and just giving yourself a nice hug, and maybe just doing a couple little gentle twist. Okay. So when you're done that, we'll continue. So the risk assessment process, Sheri is going to pick up after evaluating the risk. It's just the risk assessment, as I was saying, is identifying the hazard, evaluating the risk, finding the solutions, and then putting those solutions in place, and evaluating and monitoring the risk assessment and your workplace to make sure that changes have not been made. When you're looking at the hazard of COVID-19, it's important that you look at the location of where you are. Is your work going on indoors? Is your work going on outdoors? Are you working with a population that could be at a higher risk of contracting COVID-19? You also have to look at your site access. Who has access to your site? Is it just yourself and your supervisors and workers? Do you have clients? Do you have contractors? Do you have subcontractors that are coming in? Looking at the common work areas, so staff rooms, lunch rooms, photocopiers, workstations that a number of different people use. You need to look at all those areas where more than one person would be doing something. Tasks that require that you work in close proximity to each other. So looking at how far people are from their coworkers, from the public, from clients, and seeing how you can increase that distance to keep it within the guidelines of 6 feet. Group activities, so meetings, training, any type of education session, staff meetings, anywhere where people would have to congregate as a group to do a certain task, and look at ways, of course, that you can reduce the number of people. And anything that's shared, pens, paper, hand sanitizer, any types of tools that you have, keyboards, laptops, computers. You have to, those are all the risk factors and all the things that you would need to look at to help you identify those areas where you really need to do some focus. So once we identify the hazard, then we have to move to evaluating the risk. And risk, what we do at Workplace NL, there's many different risk evaluation tools that are out there. We stick with a very simple one. So we ask people that when they're looking at risk, they look at the probability of an incident occurring. So the probability of somebody contracting COVID-19, and then of course looking at the severity of what that illness would look like. Once you do all that, then you basically rank them at high, moderate, and low. Anything which gets a high ranking, you would have to fix that and put control measures and find solutions for that first, and then of course move down the hierarchy. So now it is Sheri's turn and she will finish off the rest of the session here today. So I'm going to change Sheri now. There we go. And I'm putting myself on mute. Thank you, guys.
Thank you, Dee-Anne. I'll just give Sheri a moment. There you go. Sheri's got it up. Boy, you're fast, Sheri.
Sorry, apparently I'm muted. Okay. Okay, so like Dee-Anne said, I'm going to walk through the finding solutions and the suggested controls that can be put into place. So you'll want to develop a plan, assess your essential functions and your reliance on suppliers, contractors, or others in your community. Review and update your emergency business plans and your business continuity plans as well. So be prepared that you may have to change your business practices. You may need to identify alternative suppliers. So if you are getting shipments from a place that is affected by COVID-19, you may not be able to get them. They may be delayed or canceled. Or if you require something such as medical grade masks or respirators, where they are in increased demand, it may be difficult to get them as well. So you may need to look at changing how you do certain tasks if you're not able to get the things that you need. You may also need to temporarily suspend some of your operations if needed. So like if you are into a situation where you would need something like a respirator and you're not able to get it, then you may need to look at an alternative method to do that task, or to put that task off until such a time when you can get the appropriate equipment. Consider how you'll operate if absenteeism spikes. So I know that a lot of you guys are probably self-employed or have minimal employees. So it's important to think about what you're going to do if you've got workers who have to be absent for extended periods of time, such as if they're caregiving for somebody who is sick, or if they have children who are not able to go to school or daycare. They may need to be off work if they have anybody who is at high risk at home, or if they're afraid to come to work because of possible exposure. It's also important to remember that the mandatory self-isolation period is 14 days. So this includes people who were potentially exposed, anybody who has symptoms, as well as anybody who has been outside of the province. So keep in mind that you may have employees who need to take 14 days off based on those requirements. So for more information on the self-isolation requirements, who should self-isolate and why they should also self-isolate and how to self-isolate, that can be found on the government website, so gov.nl.ca/COVID-19. I do have a worksheet or a handout that I can send to you guys after that has all of these links that we can, we're talking about a bunch of different websites and stuff as we go, so I've got them all compiled onto a handout that we can give to you after.
That'd be great. Thanks, Sheri.
So once the hazard is identified and the risk to workers is evaluated, controls are then put into place to either eliminate the hazard or reduce the risk to workers. The hierarchy of controls is a system used to identify the most appropriate controls for that workplace hazard. The options at the top are the most effective because they address the hazard rather than just reducing the impact. So looking at our hierarchy of controls, our most effective control is eliminating or substituting. So what this means is to either remove the hazard completely or substitute it for another, a more less hazardous option. So an example that I can give to you guys in a broad sense is eliminating the risk of COVID-19 exposure could be having your workers work from home, or substituting something. Let's say you have a hazardous chemical that you're using, you can substitute it for something that's less hazardous. And then engineering would be things that you would physically put into place. So this is like your workplace design. So modifying the layout of your workplace, putting in things such as physical barriers or ventilation. Then we have administrative controls. I like to refer to these as the paperwork. So this is the controls that determine how you do your work. So this is your safe work practices and procedures. This is education and training. This is putting into practice things such as job rotation, or scheduling workers for shorter shifts, or doing medical surveillance, putting up signage and posters, and labeling things. And then lastly, we have our PPE, which is personal protective equipment. And this is the last line of defense because it does not control the hazard. It just protects the worker from the impact of exposure. So to look a little further into our engineering controls, some things that you can consider is your workplace design, physical barriers, and ventilation. So for workplace design, things to consider would be to establish 2-meter separation between employees, clients, the public, and just general people. So you might want to consider moving desks, or like say if it's a restaurant, moving the restaurant tables, adjusting meeting rooms, just anywhere that people would be, I guess, in close proximity to each other, arranging the layout so that they are at least 2 meters apart. If you've got any narrow hallways or aisles, implement one-way travel wherever possible. Consider the whole workspace, including any shared spaces such as lunchrooms, washroom facilities, and elevators. For physical barriers, you want to think about installing physical separations between employees and the public, clients, customers, etc. These could be things such as plexiglass, or it could be if you're in cubicles, you can raise cubicle heights, or anything that will put a physical separation between you and somebody else. And then lastly, you can think about ventilation. So you can increase your ventilation by adjusting your HVAC system if possible. You can open windows. Wherever possible, you can move work outside so that you get the fresh air and the breeze to ventilate the area in which you're working. Next, to look at the administrative controls. Some things that you could consider would be health monitoring, physical distancing, personal hygiene, such as hand washing and cough or sneeze etiquette, cleaning and disinfecting, work practices and procedures, as well as worker training. So for health monitoring, you could consider implementing a procedure that monitors the health of people entering to your workplace. So this could include requiring all workers, contractors, suppliers, or visitors to confirm that they do not currently meet any of the self-isolation criteria established by the government of Newfoundland and Labrador. I actually have a hair appointment tonight, and they called me last night to ask me questions like, do you have these symptoms? Were you out of the province? Were you in contact with anybody? And they asked me if I felt comfortable wearing a mask. So like these are certain things that you could put in place when monitoring people who are entering your workplace. So self-isolation criteria, as set out by the government of Newfoundland and Labrador, includes that you've been diagnosed with COVID-19, you are a close contact of someone who has been diagnosed with COVID-19, you have been assessed by public health and are awaiting your test results, you have traveled outside of Newfoundland and Labrador, or you have been advised for some other reason by public health to self-isolate. So your procedure could include the requirement for workers who develop symptoms while at work to leave the workplace. It could also include workers who are ill to inform their supervisor that they're ill and to stay home. So workers should only return to the workplace once they've been deemed to have been recovered from COVID-19. So here's an example of a fit for work questionnaire. It's just a generic sample that we have that we use. But essentially the idea is that if anybody answers yes to those questions, then they should not be coming to work. Or if they refuse to answer these questions, then they have been deemed to have failed the screening, and you should inform them that they should call 811 and start self-isolating. Personal information is to be kept confidential. You have to determine what information that you need and only collect that information and keep it private. An employer should disclose to their employees that someone has tested positive for COVID-19 without disclosing any of the identities. So this could be simple like we've had exposure in our workplace without saying who it was. An employer should not disclose the identity of an employee who has tested positive or anything specific about his or her medical condition or symptoms to other workers in the workplace. So next we have physical distancing. So this requires that all individuals maintain at least 2 meters between them and any other individual. So maintaining the distance reduces the potential for coming into contact with respiratory droplets. So you want to look at your workplace activities and make sure that they can have physical distancing maintained. Where proper physical distancing cannot be maintained due to specific tasks or activities, consider separating people with physical barriers, or where other measures are not sufficient, consider the use of non-medical masks or face coverings in the work setting where respirators are not required, understanding that these do have limitations. So like Dee-Anne mentioned earlier, the non-medical mask or the face covering does not protect the wearer. It only protects the people around them. So it keeps you from spreading your respiratory droplets, but it does not protect you from other people's respiratory droplets. So then we have personal hygiene. So hand washing is the best way to minimize the risk of infection. Proper hand washing prevents the transfer of infectious materials from the hands to other parts of the body, particularly the eyes, nose, or mouth, or to any other surfaces that they touch. So you want to implement a policy that states that workers are to wash their hands immediately before leaving a work area, after handling materials that may be contaminated, before eating, drinking, smoking, or visiting the washroom, and as frequently as possible. Remind all workers of the hand washing procedure and consider using posters or other means to illustrate the procedure. Use soap and warm running water, and wash your hands for at least 20 seconds. If warm water is unavailable, use a waterless hand sanitizer that has at least 60% alcohol. Follow the manufacturer's instructions on how to use the cleanser. If your hands are visibly soiled, a wet wipe of some type will be needed to wipe away any of the soiling so that the sanitizer would be effective. While we're talking about hand sanitizer, I just wanted to give you a quick thing that I learned. the other day. So if you leave your hand sanitizer in your car, it'll be exposed to extreme heats. And that will create a potential for fire, as well as the chemical compound of the alcohol will start breaking down and it'll make it less effective. So if you are keeping hand sanitizer in your car, you should consider putting it somewhere else that you would take with you, like when you come inside your house, or don't leave it there for extended periods of time. So you want to implement a policy that states workers are expected to follow a cough or sneeze etiquette, which is a combination of the measures that minimizes transmission of diseases via droplets or airborne routes. So you want to educate your workers on these control measures. Post signs at the entry points to instruct everyone about the control measures. And the cough and sneeze etiquette would be to cover your mouth or nose with a sleeve or a tissue when coughing or sneezing. Use tissues to contain your cough or sneeze and dispose them into the waste container immediately. Turn your head away from others when coughing or sneezing and wash your hands regularly. This is an example of a hand washing poster. These posters are available on the Government NL website. They've got a few things that you can download and use. Or additionally, you may have your own, or you may want to design your own. But essentially, you want to have something that instructs how to wash your hands. Because although we may think that it's common sense, it's not really. So some people may not realize that they're not washing their whole hand, I guess. Because I've seen a few videos where people take like a colored paint or something, and they wash their hands, and you can tell, like, you can see where they've washed and where they haven't washed. So it's important to have these instructions up around your workplace. And then we have cleaning and disinfecting. So consider implementing enhanced cleaning and disinfecting procedures to reduce the risk of exposure. Coronavirus can survive on different surfaces and can be killed by most cleaners and disinfectants. Some examples could include cleaning and disinfecting will be done as often as possible at a minimum of the beginning of the shift, before eating, between crew changes, and at the end of the shift. All frequently touched surfaces will be cleaned and disinfected at a minimum of twice daily. This includes, but not limited to, lunchroom tables, computers, mouses or keyboards, doorknobs, light switches, handles, bathrooms, steering wheels, and stair railings. Avoid sharing items such as tools or pens, and disinfect items before sharing. Avoid sharing equipment. If you have to share equipment, clean and disinfect the points of contact on the equipment before and after use. Storage of personal gear and jackets, such as vests, rain gear, are not permitted on site unless stored in a location where contact with individuals is not possible. This is because if someone is infected with COVID-19, their respiratory droplets may be on their clothing. So if you brush up against someone's jacket, you may inadvertently contact their respiratory droplets. It's important to note to use only approved hard surface disinfectants. And there is a list from Health Canada. I've got the link to that list on my handout that I'll give you, but Health Canada website has a list of approved hard surface disinfectants that are, I guess, effective in disinfecting against COVID-19. So then we have work practices and procedures. So you want to restrict visitors and limit non-essential personnel. Limiting the number of people in a workplace is an important way to maintain physical distancing in accordance with the public health directives. This may also be done by implementing a work from home schedule or reducing some work tasks and rescheduling some work tasks for later. Ensure that a number of people in each area of the workplace is adequate to prevent coming too close to one another or members of the public. This may be done by posting occupancy limits, such as on an elevator or in a washroom or other small spaces, and by limiting the number of workers on break at any one time. Revise work schedules and reorganize work tasks to maintain a distance of 2 meters between workers and any others wherever possible. Shifts should be alternated and production levels should be lowered in order to achieve physical distancing. Stagger your start, break, and end times for employees. Implement measures to ensure workers can maintain a distance of 2 meters when serving or working with or near members of the public, such as putting in floor markings to show appropriate paths of travel or standing positions in order to maintain physical distancing. Storage of your personal gear, like I said, should not be permitted on site, or it should be in a location where contact with other individuals is not possible. You must ensure that everyone entering your workplace, including workers from other employees, know how to keep themselves safe while at your workplace. Be sure that everyone is trained on the measures that you have put into place and the policies around staying home when sick. Ensure supervisors have been trained on monitoring workers and the workplace to ensure that policies and procedures are being followed. Post signage, including occupancy limits, effective hand washing procedures, and also a signage that restricts people from entering your premise, such as a sign that says, like, if you have symptoms of COVID-19, please do not enter the store or enter the business. Workers should be trained on the risk of exposure to COVID-19 and what the signs and symptoms of the disease are. They should be trained on safe work procedures that are to be followed, including hand washing, physical distancing, safe use of face coverings, and your cough or sneeze etiquette. They should be trained on the location of washing facilities, including the dispensing stations for hand sanitizer. They should be trained on the safe selection, use, and care for personal protective equipment and fit tested where required for respiratory protection. They should be trained on how to report exposure to or symptoms of COVID-19. Ensure that workers have training and strategies required to address the risk of violence that may arise from customers or members of the public that are adapting to your restrictions. So ensure that appropriate violence prevention program is in place to prevent contact as well. Then we have personal protective equipment. So some things that you could use for personal protective equipment against exposure to COVID-19 is respirator gloves, clothing coverings, and face coverings. It's important to note that a face covering is not considered personal protective equipment. I do have it included in this section because it is an item that you wear, but it does not protect the person who's wearing them. A face covering is only effective in preventing the spread of respiratory droplets from the wearer, and thus only used to protect the people around them and not themselves. While engineering and administrative control measures are the most preferred methods to be implemented in the workplace, such as physical distancing, barriers, reducing the number of individuals on site, certain tasks or activities cannot be completed while maintaining physical distancing. For these tasks, require workers to use PPE to mitigate their exposure to COVID-19. Ensure that a hazard assessment is completed and the PPE is appropriate to the hazard or the level of risk. All PPE must meet the requirements of the Newfoundland and Labrador Occupational Health and Safety Regulations, and workers must be trained in the proper use and care of their PPE. Where physical distance cannot be maintained, a minimum requirement should be that the worker must wear a non-medical mask, and this includes cloth masks and face coverings. So again, a non-medical mask is suitable if and only if they're being used to protect solely against the transmission of COVID-19. All other COVID-19 control measures must be maintained, such as hand washing and cleaning and disinfecting. In situations where the worker has a greater risk of exposure to COVID-19, a higher level of protection will be required. For such situations, a hazard assessment will be conducted and the appropriate control measure implemented based on the level of risk. So when I say like a higher level of risk to exposure, that could be like if you're working with people who have been traveling, or if you're working with people who have COVID-19, like say you're a healthcare worker, then you would have to look at way more protective ways to protect yourself from COVID-19. Similarly, if you have hazards other than COVID-19 exposure, such as silica dust or wood dust or something that would require you to have a respirator, you must make sure that you have the appropriate PPE based on the hazards that exist in your risk assessment. So let's say you are doing something that would normally require a respirator. A non-medical mask will not suffice because you do need the respirator to protect you from those other hazards. So after you determined which control measures that you are going to put in place, you want to review and update your plan and implement your control measures. Make sure that you review and update as new information becomes available. Things may change as your business operates. So if you identify a new area of concern, or if it seems that something is not working properly, take steps to update your policies and procedures. Ensure that your employees are able to raise their safety concerns and give you input as to how these control measures are working. Review your controls that you do put into place to make sure that they do not create additional hazards. Review your current emergency response plans to ensure that you protect your workers from exposure during an emergency. So let's say, for example, one of the emergency response plans that you currently have is a fire drill or fire evacuation from a building. So you want to make sure that you can protect your workers from COVID-19 exposure during an emergency scenario. So let's say they are evacuating. You want to make sure that you protect them during the evacuation process as well as while they are at the muster point. Consider how your emergency procedures are impacted by COVID-19 public health measures. Ensure that COVID-19 measures do not introduce any new occupational hazards to the work setting, such as if you've got fire doors. Fire doors are to remain closed for a reason. They protect against fire. So if you want to increase your ventilation, do not prop open your fire door because that would create additional hazards. Communicate with your employees on how to respond to emergencies as safely as possible while COVID-19 measures are in place. For first aid, please check with your specific first aid training provider to see if they have any tips or information regarding providing first aid and CPR. The following information that I'm going to talk about was from the Red Cross, but if you do have a different provider, do check with them to see what their recommendations are. So providing first aid during the COVID-19 pandemic can raise questions around safety and transmission. According to the Public Health Agency of Canada, the COVID-19 situation is rapidly evolving and individuals could be at risk, would be dependent on a variety of considerations, including their location. If someone's heart stops and the first aider is concerned that they may have respiratory symptoms, it is the individual's discretion to perform or not to perform mouth-to-mouth breaths based on personal preference. It is still important to call emergency medical services and find an AED. If the individual chooses to perform breaths, they can also use a barrier device such as a pocket mask to help protect themselves. CPR with breaths is recommended for people who have been trained in CPR, but as an alternative, hands-only CPR can be performed until help arrives if the first aider is unsure about putting their mouth on a stranger's mouth or has concerns that the person may be positive for COVID-19. If the individual chooses to perform hands-only CPR, they should first call 911 and then lay a cloth or towel or other clothing over the person's mouth and nose to prevent any possible spread from respiratory droplets, contaminated air, or saliva. If the first aider believes that the person may have COVID-19, they should state their concerns to the emergency response telecommunicator. So when you call 911, make sure that you do indicate that you think this person has COVID-19 or you think they have respiratory symptoms, so that when the first responders do arrive, they are aware and they are prepared to be protected from COVID-19 transmission. So employers must develop documentation or plan that reduces the risk of exposure to workers and to the general public. So this plan must include a risk assessment, an overview of how the workplace is to be organized or arranged, specific activities that are going to be carried out by the workers, control measures that are to be implemented, as well as a communication and training to provide to workers, customers, and visitors. It must detail how the employer will monitor compliance with the guidelines. So at this point, we're going to take a quick micro break, and then we're going to get into our questions and answers. So if you're sitting, stand up. If you're standing, sit down. Make sure that you do move a little bit and change your posture, get the blood flowing, shake it out a little. It's suggested that you only sit for approximately 30 minutes at a time, and that you should have a sit to stand ratio of 1 to 1. I know during the workday that that's not always possible. So what you should consider is taking a micro break every 30 minutes, get up for a minute or two, walk around, or if you're standing, sit down. So the point is to change your posture and to give your muscles a bit of a relief. So just make sure you stretch where you need to stretch, shake it out, get the blood flowing. And there we go. So we're going to get into our Q&As. And what I'm going to do is, I guess we can open up everybody's mics maybe, or we can, I'm not sure how we want to do this.
What we can do, thank you, Sheri and Dee-Anne, for a great presentation. So I'll just direct people to your control panel, and that's the little thing on the side that's got the orange arrow up top. If you wish to ask a question, at the very bottom of that is the hand signal, and you can raise your hand. Or if you're not comfortable asking your question, you'd rather type it, then you can type it over in chat. And so again, on that little control panel, once you've expanded it, you just click on that little orange arrow if it's collapsed on you. You can click the plus sign next to chat, and then that will open up your chat window. And you can type any questions or comments in there, or you can raise your hand and open up your mic and ask a question or comment. So, floor is open, folks. Allison.
Hi, yes, I have a question about the extended bubble situation. I don't know if this is something that you're able to answer if we're all kind of waiting for you know, health authority decision on. But you know, currently we've got our double bubbles plus 6 people. Do you know if that's going to change with alert level 2? Because I'm wondering, you know, things are opening up. They're talking about in the next alert level that gym facilities will be open, that even you know, potentially movie theaters and you know, entertainment places and stadiums and whatnot. So I'm wondering how that's going to affect that, or if you know anything about it.
Unfortunately, we don't have any more details on that. They haven't come out with all of the details for alert level 2 yet, and I'm assuming that's going to come within the next day or two. I would say it's a safe bet to say that they are going to make some change to the bubble scenario, but I don't know what that change is as of now.
Yeah, I'm just looking at the level 2 alert, which is on the GovNL COVID-19 website, and yeah, it's not really detailed yet. It's just kind of like the umbrella statements of expanding the size of gatherings, but the number is going to be determined. Places of worship are going to be permitted to resume operations. Indoor pools can open, further expansion of camping activities, but with regards to the businesses itself and what businesses are going to be required to do, I would certainly go to that website and click on businesses and employees for the information sheets that are there, and they post up-to-date directions, guidance there all the time as well. But we're not privy to what the public health guidance is going to be for sure.
Okay, thank you.
for businesses, I've noticed when you're out in public businesses and there are individuals who are working together, a lot of times they can't social distance, you know, depending on the type of business. The actual employees themselves can't social distance. So yeah, I'm curious to see how that impacts bubbles and whatnot, because it's some things are difficult to implement.
So with regards to workplaces, the employer is required to do the risk assessment, as we know, and to determine what their control measures are going to be following public health measures. So, and then of course, if an OSH officer were to come on site, the OSH officer would look to see if those measures would be met. With regards to the social distancing or the physical distancing, the 6-foot rule is required to be maintained. And if you can't, then you are to wear that cloth mask or non-medical face mask. Or if in the risk assessment it's determined that the medical face mask is required, then that would have to be a part of the control measure as well.
Yeah, and you'll notice when you go into businesses where this physical distancing is harder, they do have some pretty good methods to keep the physical separation between the worker and the public. But as for the workers who are working in close proximity, you'll notice that most places will have them wearing the face mask or the non-medical mask while they're, like, let's say like a coffee shop or a fast food restaurant. While they're in close proximity, they do have those masks on.
Yeah, and there might be things that's going on as well behind the scenes that we can't actually see, like the health monitoring, answering the health questionnaires before they start a shift and things like that as well. But yeah, I mean, if you can't maintain that 6-foot distance, the face mask is a requirement from what we've been told by the OSH division, because that is a public health guideline.
Dee-Anne, correct me if I'm wrong, or Sheri, the risk assessment, that's part of normal business practice anyway, is it not? To always be looking at that risk. So this is just sort of a very specific risk assessment. Is that correct?
Yeah, it is.
You would always have to do a risk assessment. So it's the employer's duty to protect the worker from all potential hazards and risks within their workplace. So the risk assessment does fall into that, and it is legislative that all employers do complete this risk assessment. Specifically talking about COVID-19, it's just to make sure that you are expanding your risk assessment to think about these things, because normally people just look at, okay, what kind of risks do we have within our workplace? They don't actually think about the public health of it all.
Exactly. It's looking at those risk factors and asking yourself the questions. You know, where am I located? Am I indoors? Am I outdoors? You know, it's going through all of those questions. Now, on Thursday of last week, Workplace NL, we published and posted a COVID-19 for employers, I believe is what it's called. We can send the link out to you guys after. And that is a guideline that has been developed for employers by our health and safety advisors to help them do their own internal risk assessment. So that one is following the guidelines of the Public Health Association of Canada, and of course the Chief Medical Officer of Health as well. So we'll send you out that link, and it's a really, really good resource for employers to use to help them look at their workplace, their facilities, their work, and being able to apply all of those measures and steps that they need to take, questions that they need to ask themselves. So we can send you guys out that link as well.
Excellent, thank you.
Yeah, that's a really, really good resource that they put together, and that was put together as well in consultation with the OSH division, and they are the enforcement.
Okay. I'm going to call on individuals now in case there's any questions. So Amanda, you're open for business, and I'm sure your business has changed. Do you have any specific questions you'd like to ask our presenters today?
So my question, the main question I had that was already answered, but I do have, I was just going to type another question. So I only have one employee right now.
Right.
And when the double bubble thing happened, we didn't double bubble we decided we didn't want to, and we double bubbled with each other to make working easier.
Mm-hmm.
So I'm wondering, in that situation, are masks still required?
That is something, you know, I had a question like that from one of my friends, actually,
Yeah.
of contractors. That is something that you would really have to check with the public health on.
Mm-hmm.
Okay.
You know, there could be some little nuances there that we're just
Mhm.
that we're not seeing. Plus, that is not our jurisdiction, is to give you guidance on specific public health measures. So,
Mhm.
yeah.
Now, you definitely want to think about and consider the ways in which you guys could be exposed. So let's say, like,
Mhm.
just because you guys are in the same bubble, I guess, doesn't mean that one of you was not exposed to something somewhere along the
Yeah.
line.
That's right.
Yeah.
To make sure that you do consider all the factors when making these decisions. So it would be based on your risk assessment as to how you're going to control the exposure.
Yeah.
And if you do have specific questions that are very specific to the public health orders, there is a what are they calling it? A business resource.
It's the business response team.
Yeah, business response
Yeah.
team. They can definitely walk you through specifics in terms of, so you can give them a call or you can email them,
Mhm.
and they will walk you through specifics. So they put together a specific team based on all of the orders that were put into place, and they would be able to walk you through specifically how you can
Yeah.
accommodate those in your workplace.
Okay.
Yep.
Thank you.
Yep. And that web, like I was saying through the presentation, it has some excellent, you know, resource sheets, information sheets, fact sheets. There's even some downloadable versions of posters and signage that you can print off as well and post in your workplace. And CCOHS, which is in the web link that Sheri is going to send out to you guys after. They have some excellent resources there as well. But CCOHS is based on federal government guidelines as just a note of caution.
Okay.
Okay.
Excellent. Thank you. Angela, anything that you'd like to ask? You're coming at it from an employee perspective.
No, not really. I guess I have to wait for guidelines from my employer or my bosses to say exactly what's happening. And like I said, right now we're just opening for curbside pickup, so that's got to be worked out first.
Mm-hmm.
Yeah,
Okay.
for sure. Yep. Yep. I was kind
Right.
of hoping actually that some of the directions and guidance would be available on the website by this morning, but it's not there yet.
Okay. Allison?
Yeah, I had a question actually. One of the people who's on the call dropped off, but it would have been relevant to her. What is the legal responsibility, if any, of, for example, a volunteer organization that's bringing people together for gatherings? Like, would they be expected to uphold the same standards as an employer?
Yes, they would for sure. Yep. Yep. Because that would fall under the public health jurisdiction, right?
Mm-hmm.
Yeah.
In terms of, I mean, risk assessment and the whole 9 yards, they would still be expected to do those things,
You
or
would
just
have
public health
to,
guidelines? It's a
most
tricky
of,
one, right?
yeah, it is a tricky one, but I mean, we all have the responsibility as citizens to follow public health guidance. So that doesn't matter if we're working or if we're in the community. So, you know, they would, I'm pretty sure, that's something that I could certainly check on with our contact, John Morgan. He's an OSH officer, and but I'm pretty sure that, yeah, any volunteer groups like that, they would have to follow the directions put out by the chief medical officer's office, for sure. Yeah, I'm just thinking now on Facebook, SPCA, the SPCA thrift store, the thrift stores that that operate as nonprofit, they're all following public health guidelines. Sheri, I don't know if you have anything else to add.
I don't want to say for sure because I don't deal a whole lot with volunteer organizations in terms of occupational health and safety, but I do know that there are certain circumstances where they are required to follow the legislation. Like I do know that recently we had someone working with a board of directors overseeing a volunteer organization where they had to implement a occupational health and safety committee. So
Yeah.
I would like to check with
Yeah.
ServiceNL and the OSH division to make sure, and then get back to you on that.
Yeah.
Okay, thank you.
Excellent, thank you. I think one of the things that really struck me, Sheri, when you were talking was to think about this in terms of an emergency situation. You know, you know, fire evacuation that you gave as an example. You just think about that. You file out and you're on top of each other, leaving, you know, the place and gathering at the muster station, standing beside one another. Like I never would have even thought of that.
Yeah, and
so it's interesting to think of that.
Yeah, I used to work in the Confederation building, and we had a few fire drills, and there's like literally hundreds of people in the stairwell at any given time trying a fire evacuation. So it's like,
yeah, absolutely.
Interesting.
Definitely something to consider.
And the same for first aid. That's you know, how many people have a mouth guard readily available?
Yeah.
Yeah.
I'm a St. John ambulance instructor, and I can tell you that the rule of thumb is always your own safety first, no matter what. So COVID or not COVID, if you don't have a mouth guard, it's never recommended to put your mouth on a stranger. So, I mean, the same rules would apply to that, I would say, but you're absolutely correct. I mean, most people don't carry that type of equipment with them. But, you know, the cardinal rule in first aid is your own safety first. As selfish as that can sound, it really isn't, because if you fall into hurting yourself while you're performing first aid, well, then you're no help to the casualty or anyone else, right?
Exactly. Yeah.
I recently did the first aid course, and I may have the stat wrong, but it was something like, what, 30% of people get injured while providing first aid or something along those lines. It was a really high number, and I was quite shocked, actually.
That actually doesn't surprise me, and I always use the example, if you've ever come up, you know, if you've ever been in an accident or you've had to call for emergency services, they're never rushing in, right? Firefighters don't rush into a building, paramedics don't rush up to the car, and that's because they're taking that assessment of the risk before they even enter. Whereas individuals, we tend to rush. And, you know, I remember our neighbor fell last summer, and my husband came running in the house and said, you know, Mrs. has fallen. And I went out and took my time, and he's like, hurry up. And I said, I'm not hurrying up. I need to make sure that, you know, I'm not getting into any danger, and, you know, doing my assessment as I was approaching. But he was like, hurry.
Yeah.
I could certainly see that.
And in terms of, I guess, occupational health and safety, the numbers of injuries and fatalities that come from the rescuer is quite high. So I guess, like in the example of, like, say, a confined space, if your coworker's in the confined space and for some reason they drop, they pass out, they fall, whatever, your initial instinct is to rush right on in to help them, but you don't know why they fell. It could be something in the atmosphere, and once you get in there, then you're down 2 and they have to rescue 2 people.
Exactly.
Right? So it's
Excellent. Well, we've had everyone had to go and drop off. Angela's hung in with us to the end here. So thank you, Angela, for that. And thank you, Dee-Anne and Sheri. Fantastic presentation, very timely. something to certainly think about. So we have recorded this session, and I'll be stopping the recording momentarily, and we will I'll get that over to Allison, and we'll figure out how we're going to share that out to folks. And certainly, Sheri, send off. Yeah, and set off that follow-up, and we'll send that out as well with your links.
Yes, absolutely. The links would be really, really good as well. I know a lot of people want to join the sessions, and the timing's not always ideal. So being able to share with them after the fact is great. It will allow us to reach a broader audience.
Yeah, and feel free to share our email addresses with everybody as well. And if they have any questions for us after, they can certainly email us. And if we don't know the answer, we will certainly try to find it. That's for sure. But with regards to enforcement, John Morgan is our go-to for sure.
Okay. Excellent.
Yeah.
If you have perhaps Dee-Anne, if you have some of the contacts for the folks on the West Coast that anyone could reach out to as well.
Yes, I know over there, Carol Alexander is the one that comes to mind for me. Carol is located in service the Osh Division's Western branch.
Okay.
Yeah. I've got Carol's contact info, actually. She's a friend of mine.
There you go. Yeah, Carol is excellent. So certainly she's available and very knowledgeable.
All right. Well, excellent. Well, thank you, ladies. Thank you, everyone, for joining. And stay tuned for our next session next month, and we'll have that information out shortly. Thank you so much, Dee-Anne and Sheri, for your time. Thank you, Allison, as always, for organizing and providing the opportunity for us to bring information like this out.
Thank you so much.
My pleasure.
Carol.
Thank you. My pleasure. So have a great day, everyone, and be safe.
Thank you, guys. Have a safe day.
Thank you. You too.
Bye-bye.
Bye.